Hi, Sherry Wirtz with Dental Hygiene 411. Welcome back. Today's 411, soft teeth. Do you have them, and is there such a thing? This is what I think of when a patient tells me they have soft teeth. Teeth are made up of enamel, which is the strongest substance in the body, even stronger than our bones. People who suffer from cavities start out with perfectly strong teeth. It's poor dental habits that contribute to almost 100% of the cavities that happen in the United States. Research shows dental decay or tooth decay is caused by a particular strain of bacteria called Streptococcus mutans that live in your mouth. And it is an infectious disease. The good thing about most diseases in your mouth is it is preventable. Bacteria are usually what are to blame that cause cavities. Bacteria with plaque, along with sugars that you eat, form an acid. If that's allowed to sit on your teeth for longer than 24 hours, it weakens the enamel surface, causing decalcification. So decalcification are usually white spots that appear on your teeth, and sometimes we see them. Those areas are more susceptible to getting cavities. That's where fluoride in your mouth helps to recalcify those areas and make those areas strong, so hopefully they don't turn into cavities. Almost everyone is born with strong teeth, but there really is a condition that causes people's teeth to be more susceptible than others. This is called amelogenesis imperfecta. This is where the enamel of the teeth is improperly formed, can be thin, and you can even see it on an x-ray before the teeth have erupted into the mouth. There's not much that can be done for these teeth until they erupt into the mouth. Then sometimes, depending on the severity, they can have sealants on them, but more than likely they'll need fillings and eventually crowns because there's just not enough enamel and the dentin is already the soft layer. So it's something that these kids are usually plagued with, and those teeth are soft. But like I said, most teeth are strong. There are certain things that can happen to weaken the enamel of the tooth or affect normal development of the tooth. Here's a list of some other things that can make a tooth soft. Trauma, malnutrition, dry mouth where your pH drops below 5.5, fever while the tooth is still in development, hormone imbalances, certain genetic conditions, systemic fluoride intake of greater than 5 parts per million, and eating disorders. Acid is one thing that puts your teeth at risk more than anything else. You can have an acidic mouth without even knowing you have it. People who suffer from a condition when they wear jewelry and it turns their fingers bluish green usually have a high acidic content. Someone that has heartburn or acid reflux also can have a higher risk of getting cavities. So what can you do to prevent yourself from getting cavities and having soft spots on your teeth? Brush. Simple, right? Not always for some people. So a lot of people that I see say that they only brush once a day and for under a minute. Well, that's not going to help protect you from getting cavities, gingivitis, or gum disease. So developing a good oral hygiene habit is going to help protect you. Brush at least twice a day for 2 minutes. Floss. If you don't like to floss or that's not for you, use a water pick. If you're more susceptible to getting cavities and every time you go to the dentist you have a cavity, then I would recommend adding a fluoride rinse and definitely fluoride toothpaste. So fluoride toothpaste we usually brush and then swish and spit it out. So a fluoride rinse that after you brush and you use before you go to bed so it can be on your teeth, protecting your teeth while you sleep, is what I would recommend. It's more topically so your teeth get the fluoride instead of the rest of you. But you have to do a good job brushing your teeth, getting all the plaque off for the fluoride to be most effective. So I recommend that when you go to the dentist, when you're going at least twice a year, that you have fluoride treatments done there because that's when your teeth are the cleanest and you get the best uptake. But when you're only seeing your dentist twice a year or only once a year or never, a fluoride rinse at home is definitely better than nothing. And increasing how many times you brush your teeth, especially if you're more susceptible to getting cavities. Watching your diet, making sure that you stay away from foods high in sugar, and if you can't brush, rinsing your mouth out until you can brush. That'll help rinse out some of the sugars and acid with the plaque being there. So plaque and biofilm actually develop as soon as you stop brushing. And some people actually, as we talked about earlier, have a high acid content just in their stomach, which makes their mouths more susceptible to getting cavities. So the better routine that you can have brushing your teeth, the less likely you are to have cavities, watching what you eat and visiting your dentist regularly. Thanks for watching, and as always, I hope this was helpful. Like and subscribe, and have a great day.